Okay, we're ready to begin.
Thanks, Hannah. I'd like to welcome everyone to today's CLARiTI webinar. My name is Beth Mormino from the Stanford ADRC and the CLARiTI administrative team as well. We can go to the next slide, Phoebe. So today we're going to focus on updates related to study startup. So you'll hear from Sterling Johnson, Aaron Chen, and also Heather O'Connell from NACC. Then we're going to take a pause for questions after those updates. And then from there, we'll hear from Dr. Monica Rivera-Mint for updates from the CLARiTI Inclusion Corps. So regarding study updates, we have a number of things we'll review quite quickly. So we're going to talk a little bit about our strategic plan and goals. There's been a lot of work done on getting sites up and running. So an update on the site initiation visits and also the version 2 of the handbook. There's a number of announcements related to different ligands, different PET ligands that are being used in CLARiTI. Some details about supporting the P30 requirements, leveraging the CLARiTI protocol to do that. We also have some announcements for the investigators meeting linked to the spring ADRC meeting and upcoming webinars. And then we'll hear a number of updates from NACC regarding subawards, the EDC system, and the ADRC Community Forum. So with that, I will hand it over to Sterling Johnson.
Thank you, Beth. Hey, everybody. I just want to spend a minute on this slide, which is helping center us on our focus for the year. As we start off 2025, this is a way of orienting us to what's important. And so this is a one-pager that has our overall purpose there on the upper left, which is accurate and comprehensive diagnoses and staging of all the possible causes of neurodegeneration within the context of ADRD, Alzheimer's disease and related diseases. The ATN imaging is foundational to that, and to that we're adding plasma biomarkers and various other aspects of this to understand the profiles that may be present. Why the ADRCs? We are collectively, we follow 18,000 participants who are fairly deeply phenotyped, and now we're adding ATN and plasma to that. Of course, we are the most qualified workforce collectively who are experienced in ADRD research, and our clinical cores have the resources and represent the several diseases within ADRD. So this is the right place to do this work. We go about this with these values, and we wrote these down as that these are things that we've gleaned from you, especially center directors, as we've talked to you about why we should do CLARiTI in the first place. This has been these have been gleaned over the last several years, and all of the people, all the center leaders that we talked to mentioned generalizable science through inclusion of diverse participants as a top priority for the center's program. The next one there that we're using, these values are ways we make decisions, and so the next one there is honoring and valuing research participants as volunteer partners who make all these discoveries possible. The next one is broad sharing of data and resources and solutions, using existing infrastructure whenever we can, not reinventing the wheel, but utilizing the ADRC system as much as we possibly can, doing innovative science and collaborating in a way that pushes the science forward without regard to embargo of certain data sets or any other personal agenda. Education at multiple levels, including webinars like this, and we will launch a number of other educational things in the future. And sharing person-level results that are pertinent to our participants' own healthcare and decision-making. And in 2025, we are really focused, here on the right column, focused on study startup. We want site initiation to happen at all 36 ADRCs. And so we're initiating subawards, we're doing the site initiation visits. We're hoping that a good chunk of our ADRCs will be initiated in the first quarter, and that the rest of us will be initiated and ready to go in the second quarter. So we want everybody to be up and running by June, the end of June of this year. With that said, can we get to, if everybody was up and running at the pace we want, we would be doing about 800 ATN sets a year. Perhaps this year we'll get to 500, hopefully more. And we hope that at least 25% will be from underrepresented groups, which 25% of 500 is 125. So that's what we're hoping for. We'd really like to exceed that on both the overall recruitment as well as the proportion that are from underrepresented groups. And then the final strategy here is bringing it back to participants and helping them get the meaning that they want from this study and the information that they want out of this study by returning those results back to them. So we can talk more about this as we go along, but I wanted to ground us in that as we go forward today. And let me turn it over to Erin Chin, the overall administrative lead for the study.
Thank you, Sterling. All right, so I'm going to start off by talking about site initiation visits. I wanted to congratulate the 8 sites listed here. We've got Kansas ADRC, 1 Florida, Boston University, Mayo Clinic, Wisconsin, Penn, Stanford, and Johns Hopkins. They have all completed their site initiation visit, so they are one step closer to site activation. Next slide, please. All right, with that being said, we have another site initiation visit coming up. So this is a very important step towards site activation. This is meeting with our central monitoring service. In preparation for the site initiation visit, you will be working with our regulatory team as well as the project coordinator for your site and prepping your site regulatory binder. So we have one coming up next week. Scheduled for that one is Wake Forest, UCSD in Arizona. And then on February 10th, UC Irvine is scheduled for that one. We do have available site initiation visit dates. So we do have more room on the 10th, February 28th as well, and then on March 10th and March 28th as well. And we will continue adding more dates until all of the sites are have completed the site initiation visit. So as I stated, you will be working very closely with our CLARiTI administrative team members to work through your regulatory binder. Please plan ahead. So all of the regulatory documents must be filed before the site initiation visit occurs. So you'll be meeting with members of our team as well as the central monitoring service. And then one of the monitors will be auditing your regulatory binder at that time as well. The site initiation visits take, we like to plan for about 5 hours. They have been a little bit closer to 4. However, we want to make sure that we have time to adequately address any concerns or answer any questions. The site PI is required to be there for the first approximately 2 hours. Again, that's been taking more like an hour and a half. We can accommodate up to 5 sites per site initiation visit. So again, just continue to work with our regulatory team as well as your project coordinator, and then we'll be in touch as far as scheduling that site initiation visit. So next slide, please. All right, so next month you can expect an update to the CLARiTI study handbook. This will be version 2. Some of the updates will include communication tools, the NACC Community Forum, as well as the CLARiTI directory, workflows for visual reads, as well as return of results, and then some updated changes to case report forms, electronic data capture, as well as an updated contact roster. As we continue to work through our processes, we're certainly learning new information. We want to make sure that that's communicated to you all. So we will be updating our handbook. So you can expect that in the next month or so. Next slide, please. All right, and then this is an announcement on the amyloid tracer flutometamol. So just to let everyone know, SCAN has added flutometamol to the list of approved tracers in the SCAN manual. CLARiTI will soon be adding flutometamol to version 4 of our study protocol. So we don't have an exact date on when we'll be making that change, but probably sometime in the first quarter or second quarter of this year. We do currently have a central contract in process with GE Healthcare to have this as a central contract for CLARiTI. So if you're interested, we just want to make sure that everyone's aware of this update. If your site would be interested in this, just let your CLARiTI project coordinator know. GE Healthcare does plan to be able to supply 89% of the CLARiTI sites by the end of Q4. So if this is of interest to you, let us know. We can certainly let you know if there is a manufacturer close to your facility. All right, next slide. Sterling, on to you. Thank you.
Okay, yeah, thanks, Erin. I just have a quick note about flutalsapir and florbetapir. We've mentioned this before, but we just wanted to bring this back to your awareness. Lilly is providing us with a number of free doses. There's about 815 free doses, but it's not enough to support the project overall. And it's about 10% of the doses that we're going to need for the project. We're thinking it's going to be about 8,000 doses for amyloid and tau, because we have 2,000 people. At each of the, at baseline and follow-up, they get 2 doses apiece. So that's 4,000 doses at baseline, 4,000 at follow-up. Anyway, Lilly will be providing about 10% of those doses complimentary to us. And after that, we'll be paying full price for those Lilly tracers. We're getting a little worried about the sustainability of that, and so we want to talk to sites who plan to use either FTP or florbetapir, flutalsapir, florbetapir, and just get a sense of your long-term horizon and how you want to strategize your long-term approach to these tracers. We also have alternatives to these tracers if sites are wanting to explore other options. The other companies are, it looks like they're coming together. Lantheus just bought LMI, for those of you who haven't seen the press release on that. So there will be some options to do things with those other tracers. Okay, let's we can talk about that either in this meeting, or we can reach out to you separately and go over your particular concerns and intentions. Let's go to the next slide. So the next one I have is using CLARiTI to support your P30 imaging requirement. As you all know, in your renewal, you'll need to do 24 ATN sets per year that are paid by your administrative core. We want to have an approach where CLARiTI can be the protocol you use for that, so that you don't have to have 2 protocols that artificially compete against each other for your center participants. We think it'd be easier on everybody to have fewer protocols. And if that is the scenario you find yourself in, please talk to us about that. We had thought it would work for us to pass those costs along to you, and so you would order the dose as usual under CLARiTI, and then we would just pass those costs to you for your P30. That particular pathway isn't going to work, but we've been talking with the companies, and we think we will be able to have an alternative solution. But for now, it's on hold while we work out how this is going to work logistically. We are still interested in knowing if your site wants to explore using CLARiTI as the mechanism of how you do the 24 ATN sets for your P30, and let us know if you want to explore that option. Okay, let's go on to the next slide. I think we're back to Erin.
Go ahead, Beth.
Or Beth.
Oh, yeah, I'll do these. So as probably most folks know, the spring meeting is coming up May 5th to 6th for the ADRC program in San Francisco, which I've heard is a lovely city. Next slide. And then we were fortunate enough to be given our own investigators meeting that will follow immediately from the spring meeting. So on May 7th, we have, you can go back, or I guess this is fine. 8:30 to 11:30, we have reserved on May 7th for our first investigators kind of longer extended meeting. During this meeting, we'll have breakfast, and then we'll get updates from each core, and we're going to work in a lot of opportunities for Q&A and also discussion as well. We have a decent capacity for in-person attendance for this meeting, and we really would love to see the site PIs for CLARiTI attend if possible. As the sites are also getting initiated, there is a startup budget within the contracts, and that funding can be used to support the travel for the site PI if that is useful. And then we'll be sending out a link to RSVP for this event. We have a few webinars that are scheduled. So our next webinar in February is going to focus on NACC infrastructure for CLARiTI. And then in March, we'll hear about the return of results toolkit. It's being developed right now in CLARiTI. All right, and then I'm going to pass it over to Heather O'Connell from NACC.
Hi, everyone. Thanks, Beth. So I have a few exciting updates from NACC to share. First up is a major milestone has been reached with the first site having their fully executed subaward. So congratulations to Drs. Wolk and Dietrich at UPenn. And a special thank you to Jane and Emily on the NACC and Grants and Finance team for their support on getting this through. So this represents the first of more to come. We have 25 additional sites that are ready and in various stages of the process at UW Office of Sponsored Programs. And then there are a few sites with pending subaward documentation. So call to action for everyone is to either complete your documentation or be on the lookout and be responsive to communications from NACC Grants and Finance and UW OSP. In terms of timeline, which is on the next slide, please, we ask that the subaward documentation be submitted by the end of the month if possible. And then we're looking at the bulk of the subawards being issued and processed later in Q1, bulk happening in March, and then some spilling into April and May for those that are just submitting their documentation now. So that's what we're looking at in terms of the timeline. So very exciting. And you can feel free to reach out with any questions to nacgrants@uw.edu. And the next slide, another key milestone is that the CLARiTI EDC system has been launched on NACC's REDCap AWS instance. So this achievement reflects collaboration between the NACC tech team along with the CLARiTI admin team and additional much appreciating testing support from the Wisconsin ADRC. So what you're seeing on this slide is a snapshot of the record status dashboard within REDCap. It highlights the different study time points and the electronic versions of the case report forms for each of those study visits. And the rows that you see are the placeholders that we've pre-populated for each of the sites for our soon-to-be enrolled participants. So very exciting. This system will be rolling out to your sites as you move through the site activation process. So as training is completed, as the subawards are completed, which includes your data transfer use agreement with NACC, as well as your final site activation letter. So once all those pieces are put together, that will be officially rolled out to your site, but wanted to share the good news that the system is up and operational. Next slide. Finally, I wanted to share from NACC another plug for the ADRC Program Community Forum. So this is a place for collaboration and asking questions and learning from each other from among all the ADRC members. So we ask you to look at an email invitation you should have received on November 19th, as well as checking the link I believe is being shared in the chat. So that's there for you to click on now to look into. And as soon as you accept that invitation, you'll be added to CLARiTI groups based on your study role. So again, we're going to be gearing up with more communications, discussions on study startup and study execution as we move into that phase. So there's a lot to discuss now, so I encourage everybody to participate. Those are the updates we had from NACC, and I think now we're going to move into a Q&A. We're going to pause here for any questions that you might have on the content shared thus far. So we can check the questions in the Q&A spot, or feel free to raise your hand.
That was a lot of detail. Thanks for everybody for going through that with us. If you do have questions, just feel free to type it in the chat or raise your hand, as Heather said. Somebody did ask me a question about the LMI tracers and whether they would be at a research rate if a site used the CLARiTI protocol for that. And to our understanding, the answer is yes, that the CLARiTI research rates that we have will be applicable to the P30 if it's using our protocol.
All right, well, if there's no questions on the startup details or for NACC, I think we can move on to the inclusion core. So we're going to be hearing from Dr. Monica Rivera-Mint, who co-leads the CLARiTI Inclusion Core with Ozioma Okonkwo. So yeah, Monica, thank you for joining. Take it away.
Wonderful. Thank you, everybody. It's really good to see you all here and to see this meeting so well attended. I want to thank NACC and Sterling, Beth, and everybody in the admin core for inviting our core to present. So yes, I'm presenting on behalf of our core and our incredible team. I want to give a big shout out to our study coordinator, Alex Roboto, and our wonderful CRNs and team members and everybody who helped make this happen. So thank you for that. And Happy New Year, everybody. It's still January. I think I get to still say that. Next slide, please. So here's an overview of the themes that I'd like to cover today on behalf of the Inclusion Core. So onboarding meetings and ongoing support. So, how do we start and how do we continue our work with you, the sites? We're really happy to be talking with you here in this space and eager to meet with you if we haven't done that already. We're going to talk about the new community research liaison position and that training program. How to do culturally informed community engaged research in terms of repository and resources, and our partnership with NACC for this upcoming public facing website. And I've carved out some time for Q&A, and I'm really happy to do my best to answer any questions with any of the sites, anybody. And if you have questions that you thought of for the prior presentation, Sterling and Beth and whoever, Aaron can jump in as well, so we can have a team approach to Q&A if, anything comes up. Next slide, please. So first thing, so our Inclusion Core, we often call it IC, onboarding meetings or calls. So the goal of these meetings is not to add another thing to your very full plates. And of course, you're coming off of that, that longer SIV meeting with the admin core team. But we feel like it's really important. And so far, it's been really positive to have these Inclusion Core onboarding meetings with each of your sites. And in those sites, we're asking to have the site CLARiTI PI there, the person in leadership in your org core, your study coordinator, or whoever is really kind of the person on the ground for coordinating participants, outreach with participants, your community research liaison, if you have one yet, which again is funded by CLARiTI, and any other key leaders in your program who are involved in your inclusion and engagement effort. So maybe that's your clinical core leader, or maybe it's somebody else in that core or another core. And we recognize that each of your sites is really unique, and we are excited to get to know you better, to better understand your needs and how we can support you. So in terms of the status of the onboarding meetings that we've already had or scheduled, so we've already completed 8 meetings, onboarding meetings, including Boston, Mayo, Penn, Wisconsin, and others, and those meetings have gone really well. I think they've been really productive, helped us to get into alignment so we can better support. We've also scheduled 4 additional upcoming meetings with the sites that you see there, and we're really looking forward to those meetings as well. In terms of the content, so what to expect when you meet with us. So these meetings, first of all, they're brief. I think they're no more than about 25 minutes or so, maybe a little bit longer, but not much longer. So again, we really want to be respectful of your time and not add to site burden. But in those meetings, we talk about, we want to know what your goals are for inclusion. What's your North Star for what success means to you? You already know that the goal of CLARiTI is to, enroll at least 25% individuals from underrepresented or under-included groups, but we really are interested in knowing, are you more interested in new recruitment to replenish your cohort, or maybe really focused on retention, and really going through all of that with you. So once we understand your goals, we're really interested in learning more about your readiness. So, what resources and expertise do you already have in hand? And then the next thing is really providing you with an overview of all the resources and support services. But really in that meeting because I'm going to talk about some of that today anyway, so that's kind of a preview. But and I wanted to make sure everybody was aware of this. But really, it's about how we bring our resources and kind of services in alignment with you and your unique goals to help you be successful. Because when you're successful, we're successful. And that's what we're really excited about. And then last and not least, so things don't end with this Inclusion Core onboarding meeting. So after that onboarding meeting with us, we're going to provide regular trainings. We're going to support your community research liaison and anybody else you want us to support. And we're also available. So we're going to have regularly scheduled meetings with sites, but also we're here if you need us. So if you're coming up with a recruitment problem or retention issue, you can also reach out to us, and we're happy to provide consultation and support. This worked really well, has worked really well in ADNI, and we've had a lot of success with our sites there, and we're really excited to learn how to best work with you and develop our own way of supporting you with your own tailored needs. Next slide, please. And if there's any burning questions that come up, you can just raise your hand if you don't feel like it's appropriate to wait to the end. In terms of ongoing support for culturally informed, community engaged research, CICER, I know that's a mouthful, but for some sites, they have a lot of experience in this methodology. We know that this is an evidence-based methodology to support recruitment of underrepresented populations, but different sites have different expertise, and even those with lots of expertise, maybe we can provide support in new ways or provide resources in new ways. So here's an overview of some of the things that we provide, including biannual training webinars on our methodology. So we're hoping to be able to disseminate these trainings as part of our biannual meetings that we have in person. Number 2, we'd like to put together a repository, or we've already been putting together a repository of resources and training materials all about this topic, about these methods, so that you can just go in there and start seeing what's available and how you can tailor some of this information and these resources to your sites. We also provide certification and ongoing training to your local community research liaisons, and I'll talk a little bit about that in a moment. And again, any additional consultation or support. Next slide, please. We also really wanted you to encourage you to spend your money. So as part of your CLARiTI budgets, you have, not only do you get this FTE to enhance, inclusion and engagement of underrepresented populations to get to that 25% at least goal, but you also have $10,000 for startup funds, and sites receive annually. So that's, I believe, year 1. Erin, anybody please correct me if I say anything wrong. That's my understanding. And then you have an additional $10,000 per year for to support community outreach. So I just want to put a plug in for the startup funds. So for that 10K of startup funds, I was talking to Sterling and Beth and the team, and that can be kind of creatively disseminated, obviously within research, or within reason. But one great way to use those funds might be to send your community research liaisons and your kind of core folks involved in inclusion and engagement efforts to one of our in-person meetings, like the meeting in May, because we would love to have the community research liaisons in person to provide some of our trainings and get to know them in person and kind of support that work. That would be great. We can talk more about it if you have any questions. And thank you, Erin, for that. So that's startup. So if you're wondering, what to do, that could support also site PIs going to, the meetings and other things. So we would love to see as many of you as possible. And I believe Erin or Heather, I'm not sure, somebody talked about the meeting already and the capacity. So in terms of the community outreach funds, and again, that's $10,000 per year. If you were wondering how you could use those funds to towards this goal of inclusion and engagement, some ideas that we have for you, some suggestions would be, building relationships with local community-based organizations through, supporting a breakfast, supporting a coffee, supporting, a luncheon. All of those things, I think, food can go a long way. Also, community outreach events, tabling at health fairs, supporting advisory boards and councils for your own purposes locally to inform your local efforts. Also, participant appreciation initiatives, swag. Everybody loves swag. Everybody loves gifts. You can also use these funds towards advertising expenses, and we're open to helping you brainstorm other ways to use these funds. But again, you have them, so we really encourage you to use those funds in the community for the greater good. I'm not. I kind of want to start looking at the chat comments, but I'm going to not do that right now and save those for QA unless there's a burning question. Next slide, please. So the community research liaisons, who I just mentioned. So again, each site has funding for one FTE for community research liaison. And this is person who's really the boots on the ground for local site community engagement, really serving as a bridge between the community and your site. And so, obviously involved in community engagement and inclusion efforts to make sure that that your program becomes more integrated and seen as part of the community, not an intruder or somebody from the outside, but a trusted group of individuals who are there for partnership in the long haul. And this person also could you consider utilizing this individual to also be there to catch those participants from the community when they arrive, especially if they're new to your program, to really make sure, like, curbside service, like have them there to kind of serve as a concierge or a navigator to, bring them to your actual site. Because I can tell you can be somewhat overwhelming going to these really big, fancy academic medical centers sometimes. So that's the role, that's the big idea in terms of what we can offer. So if you haven't already hired this position in your program, we can provide you with a job description if you would like it. And this is all as needed. If you want these resources, we can provide you with a job description, help consult with a hiring process for these kinds of individuals who are ideally from the community. We can provide, we will provide the training resources and real life support and training, and we'll invite the CRLs to join each other in community to facilitate knowledge exchange, learn from, shared mistakes or things that have worked, and really be a resource to each other. And we would like to have these CRLs attend our regular inclusion core-led calls, again, not to be a burden, but to provide a support and to complete activity tracking so we can really understand what's working at the different sites, to then have that be utilized to take an evidence-based approach for the evolution of our methods. Next slide, please. I've talked a little bit about the training program already. It's here, and I'm going to skip this slide, but you're going to have that, and I'm happy to answer any questions. I want to talk about the repository. So we've put together a repository. It's not quite ready for prime time, but I think it's very close. And in there, you're going to have shared, resources, essentially like a toolkit with key seminal articles. I would love for us to put together a brain health education presentation that you could adapt to your sites, lots about how to do culturally informed community engaged research, and lots of resources for the community research liaisons. And here you see some of the topics: cultural competency, cultural humility, right? We can't go to all of this effort to recruit these individuals, and that's really hard work. Those are hard-won participants, and then not have the infrastructure and the competence to competently and ethically see them in our site. So we really want to make sure we're paying attention to that. Information on specific populations, best practices for participant engagement, and working with community advisory boards. Next slide. But everybody will get information with a link on that. And then we are working with NACC on a public-facing website. So this is also in partnership, of course, with the admin team. And this site, again, it's for the public. It's going to provide information about CLARiTI study goals and procedures, again, in very accessible language. We're going to provide recruitment materials that we're working with with a Latino-owned marketing agency on. There's going to be a web form that site visitors can use to contact the ADRCs that are in their local vicinity with questions, and if they're interested in participating, and also brain health resources, because fundamental to the ethos of culturally informed community engaged research is to provide the give first. Like, what is the give? And then then we think about what it is that we need from participants in terms of their participation. Next slide, please. And I think that's a wrap for me. So now I get to open it up to questions for folks. Any questions, comments, criticisms, anything?
There's one in the chat. So first, just a quick clarification from Aaron. So Aaron is just was just reiterating that the 10K startup funds happen in the first year, and then there is a 10K outreach fund that's
Annually.
given every year.
Thank you, Aaron.
And then there's a question from Christina Whittle. So can some of the study startup funds for be used for transportation costs to get participants to and from imaging visits, and lunch for participants on the day of their scans?
Yeah, I can hop in on that one from the contract perspective in the budget. There are specific line items in the budget for participant transportation, so you can reference that. But it's also important to note, we've heard some sites do have policies around participant reimbursement, so it's really best to check at your local level with your local grants and finance teams about those specific issues.
That's great, Heather. And that was my impression, that there was some money baked into the budget. But what about lunch? Food?
Yeah, that would be one that I would check with. I think different institutions have different policies on what you can and cannot pay participants for.
Yeah, but if
from our budget perspective, I don't think on the study startup we don't go into that level of detail. So it would be on the local side.
Okay, that's helpful.
Totally agree with that you should be able to spend these dollars on anything that's a justified research expenditure.
Great, that makes sense to me. Thanks, Christina, for that question. Is it Jagnor who has a question in the chat as well? I apologies if I mangled your name. It's beautiful. It's hi, just to clarify, the Inclusion Core onboarding meetings are after the SIV onboarding. That's right. We always go after the Admin Core's SIV launch meeting. So that's the longer meeting, 4 to 5 hours. And then once that's done, we try to wait about 2 weeks before, pestering you for our meeting. But then you would meet with us, and our meeting is quite short in comparison. Thank you for asking about that, to make sure that's clear. You're welcome. Other questions, comments, concerns? If we could, here's another question. Do you have a sense of the recruitment radius for rural folks? Randolph, what do you mean by the recruitment radius? Well, because I assume in the protocol, that is a really good question. I don't know what the protocol says. In our protocol, is there a maximum number of miles that people can be, living away from a particular site? Is that in the protocol?
No, that's not in the protocol. We list that area deprivation index of 4. That's one way that we track it in the protocol.
And when you say that, are you saying if,
RUCA code of 4.
Or
What?
I'm sorry, yes.
yeah, the RUCA, right?
Thank you.
Yeah, okay.
Thank you, Sterling. RUCA code of 4 or greater.
Yeah, so that's, yes, right, Erin. So that's a little bit different. So Randolph, we're using the RUCA and RUC and RUCA, I believe, for defining what makes somebody considered a rural individual, because that would go towards the count for your site to for somebody from an underrepresented population. Again, our 3 metrics are ethnocultural status, low SES defined by 12 years of education or less, or rurality. But in terms of, how far away, I think is your question, that radius, I think that would be really, unless there's something in the protocol, I think that would be site specific for you for what you think is realistic.
That's right.
Yeah, I think for us, like, in some of my studies, I think we've gone maybe up to 150 miles. But that's not prescribed here. But I'm not sure, Randolph, what site you're from, but when we have our IC meeting, we could talk more about this, because we've been doing some work in rural populations in some of my other studies, and I would be really interested to hear what your thoughts are, and maybe we could talk more about it. And we have some experience with doing like long hauls for visits as well, which I can tell you about that too, what that experience was like. Yes, so the area deprivation index, that's from another University of Wisconsin all-star Amy Kind. I don't have the link for it handy, but it's the ADI. I don't know. Alex is online. I don't know if we have it handy, Alex Roboto somewhere, one of our inclusion core team members from our other study. But if we can add it to the chat before we leave, we will. But the RUC and RUCA for defining rural populations is a very simple kind of also web-based calculation based on a person's address. Wow, Erin, lightning fast. There it is. Ask and you shall receive, Randolph. And information about the RUCA scores as well. Love, this is great. And maybe for one of our future webinars for training, we can talk more about some of these issues as they, go into defining underrepresented populations and working with these specific populations. Other questions or comments? These are such good questions. I really appreciate them. Anything else? Okay. Say going once, going twice. Okay. All right. So we just have one person. Oh, yes.
Sorry. What are some of the metrics that you would like us to continue reporting that could be uniform across the different institutions as a CES?
As a what?
CES, or the community liaison person, sorry.
Oh, yeah, for the community research liaisons. That's a great question. And we're finalizing those metrics now. So that's something that we're going to be rolling out to all sites. I'd actually, before we roll that out entirely, I'd like to do a training specifically on that so that we're all on the same page. So that probably would be like a CRL-wide training. But site PIs and anybody here is welcome to come to that. So we haven't rolled that out. We're really making sure we have our repository ready, the CRL training training manual, but the metrics are the next thing. And we have a format for that is very granular and ADNI that we're using. And just as an example, some of the metrics that we're looking at there that we're considering for CLARiTI, and we want some input from the admin core as well on this when we get to that point. Things like, how many, community events are you going to? What is the yield from your community events? How much time did it take? What are the kinds of, connections that you're making? Those things. And again, we're not trying to increase the burden, but just, very streamlined, kind of very simple things to answer, no pressure, but things to help us track, the efforts and the value of these efforts as well. As I thank you for that question. It's coming, but these are some of the things that we're thinking about. Is that helpful?
Yeah, thank you.
You're welcome. And I hope to see you at the Jacksonville meeting for the ADRC there. Other questions or comments? Well, if other questions or comments come up later, you have our email here, and we love to talk to sites. We like the admin core too, but we really like to talk with you at the sites, and we're really excited to work with you. So, please, keep the conversation going, and we're looking forward to seeing as many of you as possible in May. Thank you.
Thanks so much, Monica. And the rest of the inclusion team, that was fantastic. Just want to put in a plug there for our upcoming webinars. Please save the date, February 20th. We'll hear more about NACC's amazing work. And then we'll hear in March 27th from the Return of Results Core. Thank you so much for sharing that slide, Vivi. So please save those dates and you'll receive more information. You should have all received the CLARiTI Connect newsletter in your inbox earlier today. So please be on the lookout for that for additional updates. But with that, we'll give you some time back in your day, and thanks again for attending.
Thank you, everybody.